Hi, everyone. My name is MacIsaac-Jones. I'm a student researcher at U of C's Determinants of Child Development Lab. Today, I will talk to you about a meta-analysis that we're conducting, which examines the prevalence of adverse childhood experiences across racial groups. What are adverse childhood experiences, or ACEs? Well, in current literature, ACEs are defined as experiences of abuse, neglect, and household dysfunction. Unfortunately, we know that ACEs are common. Around 60% of people worldwide have experienced at least one ACE. And they're also linked to lifelong physical and mental health difficulties, like an increased risk for suicidality, diabetes, and many other things. So far, there's very little research that attempts to disentangle racial differences in ACEs exposure. Because this research is limited, we're hopeful that a meta-analysis can help by allowing us to draw on samples from multiple studies to get a better idea of the big picture. We're expecting that global rates of ACEs are going to be higher among BIPOC populations because these folks experience more discrimination and reduced access to healthcare. In Canada, for example, Indigenous children growing up on reserve typically experience reduced access to healthcare due to federal underfunding and significant discrimination where healthcare is available. Ultimately, we're trying to find out whether or not these experiences of stigma and mental health difficulties among racialized populations are linked to the prevalence of ACEs. This research is important because Canada is becoming an increasingly ethnically and racially diverse country. Due to high rates of racism and low access to support, we believe that ACEs rates may be higher for some Canadians, particularly those identifying as Indigenous. If ACEs prevalence rates do vary depending on individuals' race, results can inform policy, and we can work with at-risk communities to increase support. The objective of our research was to synthesize the prevalence of ACEs among different racial groups using a meta-analysis. We're hypothesizing to see a positive association between ACEs prevalence rates and racialized identity. To conduct our meta-analysis, we used our lab's ACEs catalog. This is a database that we have of around 3,500 studies published between 1998 and 2021 that examine ACEs. Throughout the last few months, myself and other lab members scanned the catalog for studies that reported participants' racial identity. We found that 206 studies with a sample size of just under 550,000 reported overall ACEs prevalence and participants' racial identity. From there, we extracted data from the studies and analyzed it, comparing ACEs prevalence rates among different racial groups. Participants in our study reported 6 racial identities. Our sample also included participants from 22 countries around the world. Our analysis found that Asian and white participants were least likely to experience 4 or more ACEs. Indigenous participants were by far the most likely to experience at least 4 ACEs. Similarly, our analysis also found that Asian and white participants were most likely to experience no ACEs, while Latinx and Indigenous participants were least likely to experience 0 ACEs. We now know that individuals who are Indigenous, Black, or Latinx face a higher rate of victimization in the form of ACEs than white and Asian individuals. We also know that Indigenous participants are particularly likely to experience 4 or more ACEs. What do our results mean? They mean that support for community-driven ACEs prevention among at-risk groups should be increased. We're hopeful that if this occurs, the increased mental health difficulties faced by these populations and the increased rates of ACEs can be mitigated. Thank you.